Good morning, and welcome to Exercise as Medicine. Again, my name is Dexter, and I'm a physical therapist and clinical director at OrthoSport, Hawaii, and this is Rebecca Graham again, one of our amazing physical therapists. OrthoSport is a locally owned and operated physical therapy clinic with 3 locations that service Oahu. So today, we will be talking about exercise as medicine. We will be presenting to you some general recommendations and guidelines on exercise based on new research and expert recommendation. Please consult a physician or physical therapist for more recommendations on your own specific needs. So aging. The human aging process is universal, ubiquitous, and inevitable. Every physiological function is being continuously diminished. It's happening to every one of us. For some of us, it might feel like it's happening a little faster than others. Maybe your knees are cracking when you get up, or maybe that groan you make when you get up from picking something up from the ground. Or maybe it's feeling the next storm coming in through your knees. All these feelings can be associated with aging. Some of the effects of aging include a decline in muscle function, cardiorespiratory fitness, balance, power, and physical activity. And those things contribute to an overall increased risk of falls. But it can also look like having a hard time lifting that luggage, or breathing a little harder to make it up those stairs, or taking a little longer to get up from that low chair, or maybe not having enough energy to do much after cleaning the house or yard. And those things can contribute to us being overall a little bit more sedentary, which can in turn accelerate some of those aging processes even further. So these are the physiological effects of aging. And in addition to that, some of the things not listed on this are some of the psychological and cognitive declines associated with aging. And that can be with reasoning, processing, speed, memory, like where did I leave my keys, or what was the name of that one guy in that one movie. And these effects of aging, the decline in these functions are inevitable, but they don't have to be unavoidable. There are things that we can do about it. With the addition of exercise and an increase in physical activity, these effects can be substantially attenuated and slowed down. So exercise. We don't stop moving because we grow old. We grow old because we stop moving. A sedentary lifestyle is more associated with those health-related declines, but exercise can help attenuate, reverse, and even prevent some of these effects of aging. When talking about increasing activity, we look at 2 things. A person's amount of overall physical activity and their exercise. So physical activity can look like their overall daily activities or behaviors. So that could be taking your dog out for a walk, gardening, maybe taking a walk to work instead of driving, or taking the stairs instead of the elevator, or standing more during the day than sitting. And when we look at exercise, we look at kind of more of a structured exercise. That means more purposeful and goal-oriented activities with a goal such as maybe resistance training to get stronger, or improving your cardio by going for a walk after dinner, or practicing some balance exercises to improve your stability and confidence, or maybe practicing your pickleball serve to impress your grandkids. The World Health Organization states that one of the most significant public health problems is insufficient physical activity and a sedentary lifestyle. And this is a major modifiable factor that by just avoiding a sedentary lifestyle and increasing your overall physical activity, a person can improve their health over an entire lifespan, not just as they are aging. And in an ideal world, we would just be able to have those healthy bodies and the ability to be active and stay active, doing all the things required for daily living and any recreational things that we want to participate in. But for many of us, that's not the case. And that could be due to injury, illness, or disease, or just being more sedentary and homebound than we'd like to be due to the pandemic. And all these things are contributing to these aging factors being accelerated. And in those cases, we may need a little bit more of an emphasis on that structured exercise prior to increasing our overall physical activity levels. And that structured exercise can look like physical therapy to help you achieve your strength, mobility, and balance levels required to get you back to safely participating in those activities you want to. And with an increase in physical activity, there are also physiological benefits. So those include an improvement in frailty, body mass, strength, mobility, and balance, like I talked about earlier, which can in turn reduce your overall risk of falls, which Rebecca will talk about later in the second half. And that can improve our overall capacity to handle more physical activities without feeling worn out by improving our energy levels, our muscle function, our cardiorespiratory fitness. So essentially, exercise can allow you to move better. In addition to the physiological effects, there's also a growing body of research showing the psychological benefits of exercise, and that includes improved mental health, improved cognition, and overall allowing you to just feel better. We know exercise can improve muscular fitness, and now brain health and fitness is an area with an increasing body of research showing its benefits from everything from depression, PTSD, anxiety, and schizophrenia. So the benefits of exercise: it can improve the quality of life, allow you to move better and feel better, improve capacity for daily activities, and maintain your independence, and just overall reduction in mortality. So let's talk about exercise as medicine. So exercise and physical activity can be more than just for fitness. Exercise can be for medicine, for chronic conditions and diseases, for risk reduction, treatment, and even prevention. Let's see here. And there's robust evidence supporting exercise as prevention and treatment of many chronic diseases. Some obvious ones are obesity and hypertension, sarcopenia, osteoporosis, and arthritis, to name a few others. But it can also help with depression, dementia, Parkinson's disease, and even cancer. So I will briefly highlight a few. So for Parkinson's, recently a growing body of evidence has suggested that physical activity can reduce the risk of Parkinson's disease and partially improve motor and non-motor symptoms during the disease course. In Alzheimer's, exercise intervention in the early stages could slow down cognitive impairment and provide a promising, cost-effective, non-pharmacological therapy. And the same can be said about dementia, which currently there are no effective drug treatments. Exercise serves as the primary role in prevention and treatment. And in these cases, dosage and supervision of those exercises is important, as there is no evidence showing the effectiveness of slow-intensity, minimally progressive exercise to help with mild to moderate dementia. But effective therapy and treatment for dementia has been shown with meaningful exercises, with clearly guided instructions with progressive intensity for resistance and balance training. And that can be provided by a PT in a clinic or with a PT coming to your home to provide those services for you or a loved one. Also with depression, exercise and physical activity can be effective alternative to medication, and studies have shown that there being up to an 88% of meaningful improvement with aerobic and resistance exercises with high intensity exercises over lower intensity of exercises. So that again highlights the importance of dosage, with lower intensity exercises not being as effective as higher intensity ones. Exercise is medicine. It's a whole body approach. It's directed at several physiological symptoms simultaneously, and it's cost effective. It's non-pharmacological. And in cases like depression, exercise is an alternative to those pharmacological treatments. So brain fitness here. So exercise to improve cognition, brain fitness. So there's evidence showing that there is a minimally effective exercise dosage needed to provide clinically relevant changes in cognition. So a study recommended about 725 MET minutes per week. So a MET minute is the amount of energy expended during a minute while at rest. That's about 12 hours a week here. But you can burn more METs a minute with increased intensity. So in this study, they recommended resistance exercises to increase that intensity. So we're fighting against aging, and ways we can do that is to increase physical activity and structured exercises, like we talked about earlier. So against aging, we can improve our physical activity levels. So physical activity is any movement produced by your muscles that increases energy expenditure from your daily activities. And a physical therapist can be somebody that can help make recommendations on activity advice to increase that intensity safely. With structured exercise, we increase that with, what that is an activity with a goal in mind that we can use to improve our activity levels here. So some of the goals could be working with a physical therapist to address any limitations preventing you from being more active. Or it can be your own planned aerobic or resistance program. The main thing is to get active and stay active. And if there are any limitations to that, a physical therapist can help. So with physical activity, so physical therapy, so what we do as physical therapists, we assess limitations, whether it be with pain, mobility, strength, or balance, to help develop, and we help to develop a plan with those limitations and goals in mind, to help modify, and we can modify and progress the intensity as needed here. And if you aren't familiar with a physical therapist, we are movement specialists. We help to improve the way you move. And we do that by diagnosing and treating movement limitations. And we do that by prescribing exercises. We can provide hands-on care as needed. And we also provide patient education on how to independently manage those movement limitations that you might have. So next I'll pass it off to Rebecca. We'll talk about falls, which is a common thing that we have people coming to physical therapy for.
So Dexter and I were scared of you guys, so we felt like we needed two of us to kind of put up a united front here, but here we are to kind of support each other and to kind of be each other's hitman. But I'm here to talk about that dreaded F word. This is something that we ideally want to really help prevent people experience, especially as we get older when there might be other comorbidities that could make a fall a lot worse than just a tuck and roll situation. So here's a not great statistic. Your chances of falling after the age of 65 is 1/3 to 1/2% of those people in that age. That you have an increased risk of falling once you've had a fall, and then we talked about some of those not so great things that can happen once you have a fall. So 5% of those falls can result in broken bones, and something that we might see a lot of is hip fractures. That's something we think about a lot in results of a fall. In my line of work, I have met people that have fallen on the floor and been stuck on the floor for several days. And that can be a really horrible experience and can sometimes be fatal. So this is something I'm really passionate about on how can we try to prevent this horrible thing from happening to people as we get older or from a loved one. So in the next few slides, we're going to kind of go over assessing your risk of falls and balance impairments and how can we modify that risk. And then how can we try to mitigate things or prevent this horrible thing from happening to people? So our first fall risk assessment, I recently just watched last year's physical therapy mini med school. And so we've accidentally stolen this one from Kevin Lockett's. But if you guys are a repeat offender, we can try it again. And if you performed this last year, you can maybe see how you're testing this year versus last year. So if you guys are willing, let's set yourselves up so you can practice getting up and down from a chair as many times as possible in 30 seconds. So if you're willing to perform this, get yourselves ready. We're going to get a timer going. Dexter and I are going to race each other, so this can be a little more interesting as well. So hopefully you're all ready. All right, ready, set, go. Try not to use your arms. Count. How are we doing? Halfway through, we can keep going. It's your exercise for the day. For the year. Almost there, almost there. Keep it up. Squat challenge. All right, and we're there. All right, hopefully you were counting, and that wasn't for no reason, and you didn't forget that part. Okay, so here's the statistics. Hopefully you blew that out of the water. I was a little nervous, so I don't think I was counting all of mine, but I'm sure Dexter beat me. So this one, I don't know if you can remember how you did last year, but maybe you're doing better this year, hopefully. Or if you're noticing some new issues with that sit to stand, that might be something you can work on. Maybe you need to use your arms, or is there a new knee or ankle problem you're having a problem with? Maybe you need a little more structured exercise like what Dexter was talking about. So we're going to go over, catching my breath, too many squats. This next one I didn't steal from Kevin. So here's one more balance assessment you can do for yourself or a loved one. This one's called the timed up and go, or tug test. So we also need a chair and a target. So we're going to set up our chairs a little differently here. So this one you guys don't have to participate in because we might not have as much room. But you just want to count 10 paces. So I just count with my feet. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Quick draw. No, just kidding. So we'll have our targets. And then you're just going to circle around that target. So with this one, you'll also set a timer. How long does it take for you to stand up from the chair, make your way around the target, and sit back down again? All right, ready, Dexter? I got heels on, so ready, set, go. All right, we made it. Okay, so let's look at what those statistics mean. So anything longer than 12 seconds means you have an increased risk of falling. Not saying, our patients are never usually running around those targets. Or it's just not an appropriate test to test on somebody that's able to do that. So I like this test because it shows how's your transferability, kind of like those sit-to-stands. So is that something that's difficult? A lot of times I also notice in this test that when somebody has an assistive device, it almost takes them about 6 seconds just to get their assistive device kind of finagled. So that's something you can kind of work on, like having that placed in the right spot. How quickly can you get yourself set up with your cane or your walker? Another issue we notice a lot with some of our elderly folks is negotiating an obstacle. So maneuvering around a corner or something that's on the ground, people will tend to cross their feet or maybe lose their balance. A lot of times they're able to correct it themselves, but we can kind of see a lot of things with that test. What's their walking speed? Can they, pivot? Can they do they have visual issues? And then how's their transfer? So I like that test a lot for some of our elderly folks. There's a new app I found when we were kind of putting this program together. It's called ViviFrail. We don't have a slide for it, but it's VI Frail. You can either Google it or there's an app for your phone. What's nice about it is it helps you, or if you're a caregiver to somebody, run through some of these tests. It has a timer and everything in the app. And then based on what you test, it gives you a list of exercises. And so every week you get a new set of exercises. You can keep yourself accountable. And so it's really nice because it kind of puts you in like one of 4 categories based on what your balance testing was. So how do you decrease your risk of falls? Let's say, somebody's in that higher impairment of balance category with some of those tests. One big thing we've been talking about is improving your exercise. So if you can improve that endurance, if you can improve that strength, that really can help with balance. So if we talk about the WHO's global recommendations for physical activity, you can think of 3 at least. So 3 times a week for 30 minutes is what they recommend for aerobic conditioning. And ideally, 70 to 80% of like a repetition max or moderate to vigorous, levels of conditioning. That shows kind of the most benefits in multiple levels of disease prevention and some of the things that Dexter talked about. So 3 times a week for 30 minutes, kind of try to get that like, we were just doing this, I was a little bit harder at breath. So just trying to get that breathing and that heart rate going. The other recommendation is twice a week for strength and balance training. The issue with those is like what you guys talked about earlier. We wish we were doing these things, or we think we're doing these things. It can be challenging to make that a priority. When they reflect looking at this statistic, we find that only 50% of people in the United States are meeting one of those categories. So how do we get people to kind of do this a little bit more? Sometimes it's hard to get started, or you don't know how to get started, especially maybe an elderly person that hasn't worked out in a long time. We might recommend just starting with one simple thing that they're doing every day. Maybe they're doing 10 sit-to-stands. It's very functional. It's part of that test. Maybe that's all they're doing every day, and they've kind of met that goal. Maybe we can add something else on. Okay, let's balance at the counter for 30 seconds every day. The other thing to consider is maybe lifestyle integration. Taking the stairs, everybody knows all these things. Taking the stairs instead of the elevator, parking further away, maybe standing on one foot while you're washing the dishes. A lot of my patients, I think, can be challenged just working on their home exercise program. So for some of my ankle people, I tell them just to work on their heel raises while they're brushing their teeth. So at least it's something they can think about doing every day. How can you add some of this stuff into your daily life? Let's talk about the systems of balance. So we kind of have 3 main systems that kind of help tell our body what's going on while we're moving. So we have our visual system, our vestibular system, and our proprioceptive system. With vision, of course, we want to see where we're going. Our vestibular system kind of tells our brain and our body where we are in space. And our proprioceptive system kind of tells us what our feet are doing or how hard they're hitting the ground. So talking about factors for falls and going through those balance systems, what are things we can try to do to help out that visual system or to kind of monitor that visual system? We usually recommend that our patients follow up with their optometrist every year to make sure they have a prescription that's meeting their needs. Maybe you now need bifocals. What's going on with cataracts? Is there any retinal things going on? Those things are a little bit beyond our scope of practice, and we just want to make sure that those things are kind of being monitored. Nighttime things can be an issue because our visual senses are a little more impaired. If somebody's worried about falls or negotiating getting up to the bathroom at night, I always recommend night lights. If you don't like a night light, you could probably get a censored night light that just comes on when you're moving. Prepare for yourself. Do you have a clear path to get from your bed to the bathroom? Are you somebody that feels like you have to rush to the bathroom? Is there some incontinence issues that are going on? If that's the case, I always recommend, don't rush to get to the bathroom because that really increases your risks for a possible disaster. So I always tell people it's better to have an accident than to rush to the bathroom, and then you're going to have an accident anyway. If it's bad enough, depends, and there's even bedside commodes that are available if you're a caregiver and this is something that's a big problem. The vestibular system. This can sometimes be challenged due to viruses, a neurological impairment, or sometimes just rocks that are deciding to roll around in your head. So we'll talk more about that on another slide. And then there's that proprioceptive system, and that can sometimes be impaired from sensory issues, Is there nerve impairment? Is there diabetic neuropathy? Was there a stroke or a neurovascular event? Is that limiting your ability to feel your feet on the ground? And in that regard, maybe you have to adapt some compensation strategies. Maybe you need an assistive device, you need an AFO, maybe you need better footwear. And then as a physical therapist, if we're developing strategies, when let's say we're talking about this getting up at night to go to the bathroom, maybe you need to keep a cane by your bed, or maybe you need to make sure you're lifting your feet a little higher than you normally would. And then of course that not having the clutter around that path to get from the bed to the bath. So talking about vestibular rehab, how can a physical therapist help you with your dizzy or vestibular issues? We can assess what your eyes are doing, how's your gaze, how are you able to look at things, are your eyes kind of moving quickly enough and giving your brain the right information? We can assess your balance, and then we can also do some positional testing to maybe see if there's something else going on with some of the canals in your inner ear. Let's talk about something that is sometimes a little more common. So maybe you yourself or somebody you know, have you ever gotten out of bed and just had this horrible bout of dizziness? You felt like you're gonna fall over, you're on a roller coaster, maybe you're gonna throw up. It kind of went through its course and you were able to get up again, but then when you went to go lay down, it happened all over again. This can be really scary. A lot of people will generally like to go see their doctor for this because why did this happen out of nowhere? I didn't have a trauma. Am I having a stroke? What's going on? A lot of times, once your doctor screened you to make sure there's no neurovascular event going on, they might diagnose you with something called BPPV, benign paroxysmal positional vertigo. What is that? Well, remember we were talking about rocks in your head. Well, when your mom said you have rocks in your head, she wasn't lying. You have these things called otoliths that sit inside that snail-looking thing in your inner ear. And for some reason or another, every once in a while in people, when you go to lay down, sometimes those rocks will leave the area they're supposed to be in and slide back into this posterior canal. That's not where they're supposed to be. Those canals are really sensitive instruments to kind of tell your brain where you are in space. Those rocks will make you think you're now on a roller coaster. They're giving your brain the wrong information. Well, how do we fix that? If that's actually your diagnosis, it's actually really easy to fix. It's really easy to diagnose, and it's really easy to fix. Sometimes a doctor might know how to do this repositioning treatment. Sometimes they might not feel comfortable with it, so they send them to us. We take their history, that's what it sounds like. All right, let's throw you over this table. What are your eyes doing? Are you symptomatic? We usually make you feel really terrible, but we flip you around, move your head around, get you back up, and usually don't feel great for about a day, but oh wow, my dizziness is gone. I can lay down again. I can move again. So with BPPV, it's actually a nicer diagnosis to get than some other dizzy diseases. So other things that could be going on in a multitude of vestibular issues. Vestibular nerve hypofunctioning can be a big one. That can just happen from a virus. It can happen from a central neurological issue. There's also a thing called Meniere's disease that's usually from increased fluid happening in your ear. And then, of course, there's just central brain things that could be going on. So our job is to try to work on making those nerves or your brain reactions work a little bit faster or a little bit harder. So we're trying to accommodate those nerves or some of the reflexes to get things to work or accommodate. So we're usually trying to work on weird eye exercises, shaking your head, looking at a target, walking while turning your head, working on variances of balance exercises. And those type of nerve accommodation exercises can usually take a lot longer than that one repositioning treatment that a lot of times doctors send us patients for. All right, now that you guys know how to perform those balance tests, you're halfway to your PT degree. So how to keep going? How do we develop a treatment plan for what's going on? How do we work on those impairments? So again, you can kind of work on some of the guidelines that we gave you of just progressing movement and progressing activity. So what was that recommendation again? 3 times a week, 30 minutes, aerobic exercise, 2 times a week, strength training. So really try to check those boxes as much as you can. But again, like Dexter said, let's say you need something a little more specific or a little more structured. You might want a medical professional. You might want a physical therapist to help guide you. You might want even just a personal trainer. Maybe somebody that can just kind of help you one-on-one with some of your issues. All right, so this is going to be a lot of information. What can you do to set up your home for now or for the future, for yourself or for a loved one, to help mitigate some of those risks of falling or imbalance? I always tell people, maybe you have a home and you're thinking about future renovation work, maybe really think about your future self. Is this somewhere where you plan to stay for the rest of your life? Are you planning to move in a loved one that might need some extra help? If you are planning for renovations, really think about what would make your life easier in your home. For example, every Tuesday I work at the surgery center in the afternoons, and I see patients the same day after their total hip or total knee replacement. And there's so many times that I really wish we could have done a prehab session to talk about what their home setup is and what are things they could purchase for themselves before their surgery. When I'm getting their history and I'm learning about, how is it going to be from them to get to their car to their house, or how many stairs do they have to get in, or how many stairs do they have to get into their house, I always get so frustrated when we have 24 stairs with no railings, and mom's 90 years old, and we don't have a crutch or a cane or anything. And then we practice trying to do that with the son or whoever's there, and it's almost impossible, to the point that we're maybe letting them lease a wheelchair to help bop them up the stairs. So for me, I almost can get really disheartened when there's a really challenging situation. We want to make sure these people are safe and they can recover well in their home. So please, please, please get quotes. Think about putting railings on your stairs. Even just one rail will make your life or your loved one's life so much easier. If you just have like 1 or 2 stairs to get in, or sometimes just a grab bar by your door can be a good enough thing, but stairs can be really challenging after a surgery, or if weakness has happened. There's also those chairlift or elevators. There's outdoor and indoor options for those. I also tell people, when you're planning for the future or after a surgery, can you do everything on one level? Is that a possibility? Could you set up a bed situation downstairs where you don't have to go up to that second level? Is there a bathroom downstairs? So these are all things to think about if maybe you're moving to a new home or you're redesigning your home. So remember, we talked about not rushing to the bathroom. There's also pelvic floor physical therapy that exists, because incontinence is never normal as an adult, just like back pain's not normal. So pelvic floor incontinence can be treated by physical therapy, just like back pain can be treated by physical therapy. So that's something you could kind of look out for as well. Okay, remember that F word? We're going to talk about it in regards to being in your bathroom. It can happen a lot in there, those falls. So things you can do for your toilet. You can buy a higher toilet. You can put an elevated riser on your toilet. That bedside commode we were talking about, you can take out the pot part and put it over the toilet. Then it has handrails that makes your toilet higher. I recommend shower benches more than a shower chair. If you have a tub, you can sit on the bench and slide your legs over. You can get grab bars installed into your bathroom. You can get the suction cup grab bars for your bathroom, anti-grip, like the anti-slip grip tape. You can put it in your shower. Consider, can a walker make it through, from your bed to the bath? Do you have that type of space? Handheld shower head is a good option. There's long-handled sponges. And then I always recommend that initially, if somebody has some balance issues, that their loved one watches them or helps them get in and out of the shower initially, because that can be the really hard part of the transfer. How do I get in this tub? How do I get out of this tub? Are you limping or walking hurts a lot? Maybe you need an assist device. Maybe you need an ankle brace. You need a knee brace. Maybe you need a ankle foot orthotic. Maybe you need a cane. There's lots of different options out there, and a physical therapist is specialized in helping you figure that out. Let's say somebody can't walk more than 10 feet. We can help you get set up to get an electric wheelchair, depending on what your diagnoses and impairments are. We recommend not using step stools and trying to place your objects around your home, not having things high, not having things low, like the kitchen stuff you use, try to have it at a level that's easy for you to get to. Well, that's a lot of info, and I don't think we have a whole lot of time left, so let's go into options of let's say you can't get to outpatient physical therapy. So there's home health that's available, medical assisted home health. If you're considered homebound, you can get home physical therapy, home occupational therapy, home speech therapy, home nursing, home wound care. So all that can be done in the home if you're considered a homebound person. Let's say you're not homebound, but you still need a little bit of help. You can pay for a caregiver to come help you with some of those things. If you don't want that, you can get a senior fare bus pass if you have transportation issues, if you're wanting to get to an exercise program, but transportation's a problem. So there's a HOLO or senior gift, a senior bus pass. It's only $45 a year. You can get signed up for that at satellite city halls. You can't walk to the bus stop. Well, there is the bus that can come get you door to door, the handy van. You have to do an in-person interview to assess your disability, and you still have to pay $2.25 per ride to do that. The state does have aging transportation assistance as well. You can call some of the state entities. They will take you door to door. I think your amount of rides is limited with that, and that might also be free. We also want to talk about maintenance programs. So a lot of my patients aren't good about following up with their home exercise program. Maybe you might like using an app like the ViviFrail. I like to refer a lot of my patients to the Y. The Y here has a lot of really great aging programs. They have chair yoga, they have Tai Chi for falls, they have low impact water aerobics, and you can join the Kapuna Club, and those specific classes can be free, or you can become a Y member at a discounted rate. I think it's around like $40 or $50 a month. Some of the Ys even offer healthy meals to seniors that are signed up for that Kapuna Club as well. So again, our company offers physical therapy. We offer personal training, one-on-one, or semi-private options. So we try to help, quantify that spectrum of care. So when you're done with physical therapy, we'll want to make sure you are going to be compliant with some type of maintenance program. So if you wanted a one-on-one trainer, we can help you get set up with that. We also have a nutritionist on staff, or I try to really push a lot of my patients to joining the Y, just because I know somebody there is kind of monitoring it, and I don't know, how well my patients are always going to do things on their own. I didn't go through these, sorry. How do you make your exercises more challenging? You can go from sitting, you can go from standing, you can go from a wide base of support, a small base of support, being on a squishy surface, adding arm movements, adding your head movements, adding eye movements. So there's a lot of things you can do, and again, these might be a little more structured initially and might want some physical therapy guidance to help you with that. All right, do we have any questions?
Thank you so much, Dexter and Rebecca. Virginia raised her hand.
I decided to go to a personal trainer to build muscle, but also he could keep me safe. And I was wondering, he also teaches me stretches, and one of my favorites is before you get up in the morning, is pull your knees to your chest and hold it for 30 seconds, 3 times. So I was wondering what common stretches you recommend for folks.
Yeah, so that's a great option. So I think a lot of us, as we get older, our joints become a little bit stiffer, maybe a little bit worn, and the mornings can be tough for us. So a good way to get moving and stay moving is to start with some gentle stretches. For example, with that, when you pull your knees to your chest while you're laying down, you're able to bend your knee, your hip, and stretch your back at the same time. And you can do so without putting a lot of stress in your joints to start out. Once you get those joints moved up and warmed up, then when you put weight onto it, it's likely going to be a little less painful and uncomfortable. So So depending on which joint, maybe that might be sore or painful for you guys. Just think about some gentle moves you can do without any weight when you first wake up in the morning. Or maybe after sitting for a while, your knees might be a little sore, your hips might be a little sore. Just kind of warm them up, move them back and forth before you put weight onto them. And then once you put weight onto them, they're ready to kind of handle that load. So yeah, does that answer your question?
What's the best way to prevent thrombosis of the leg, especially when you're sitting on the airplane for 10 hours? Besides pressure stocking, what's the best stretches or things to do?
So there's 3 main circulation exercises that I give to all my patients when I know they're going to be a little more bedbound or after a surgery. So number 1 is ankle pumps. So that's going to use your calves as an active muscle pump. Number 2 is quad sets. So if you have the ability to kind of straighten out your leg and try to push your knee down into the ground, it's kind of squeezing that quad muscle. That's using your big quad muscle as a muscle pump. And the third one is glute sets, trying to squeeze your butt and relax. So I recommend my post-op patients, to reduce the risk of blood clots and to improve circulation, I recommend they do those 10 times every hour that they're awake. There's other things out there if your impairments are more serious. There's, the compression stockings. There's now those pneumatic pumps you can put around your legs. And then ideally, if you can get out of your seat and walk around, that's going to be even better. But those 3 circulation exercises are a big good one.
So just to add to that too, so your body's designed to move. So after sitting for a while, circulation gets reduced. So any way to get you moving. If you're stuck in a middle seat and you need to get those muscles pumping, those exercises are great for that. But if you can, pick an aisle seat and get up as often as you can and go to the bathroom, maybe stand up and walk around the aisles. Any movement can be helpful.
What are your views on the benefits of a vibration machine?
So my one negative on that is, and that's more from personal experience, I've had a couple patients that also have back issues that went directly into a vibration platform and trying to do exercises on that. That would be something that would ramp up a balance exercise. So let's say you're already struggling standing on one leg on a flat surface. I wouldn't recommend going from a flat surface to a vibrating surface if you're already challenged being on the ground. But for people that maybe have nerve issues or maybe some swelling issues, you could sit and put your feet on it, and having some of that vibration can be helpful with neurological issues. Sometimes it can help with sensory things. And it can be something that's helpful if your balance is good. If you have good core control, you could stand on it, and that could be good for your body while you're doing exercises. I would just say it is going to be a much more challenging exercise, and so that would just be something to make things a little more difficult, if that's what you needed.
Yeah, and just to add to that, I haven't read any specific research on vibration, but basically anything to kind of encourage you to move is good. Whether that's getting a vibration machine, whether that's going to the ocean and doing some things in the water, or getting a nice new pair of shoes, anything to encourage you to move is going to be beneficial. And most of the things that I mentioned earlier are just based on general exercise, movement, and activity. So a machine is not needed, but if that's something that you have the option of using, that can be beneficial as well to encourage that movement.
We have a question from our online audience. How do you prevent severe calf cramps?
So I feel like we get this question a lot from our patients, why is my calf cramping? Why is my hamstring cramping? A lot of times it can be from a short muscle that's also weak. So I have some patients doing bridges on a table. Well, their hamstrings are now in a shortened position, and we're working on activating those hamstrings. Ooh, cramps happening. Well, it's generally from a muscle that's tight, so a lot of times hamstrings can be tight in people, and now we're trying to make that tight muscle work in a shortened position. So sometimes it's due to tightness, sometimes it's due to weakness of that muscle, sometimes there could be a systemic thing going on. So that's why I feel like yearly lab work is important, because there could be a potassium or a sodium impairment happening. Why are you getting these constant cramps? If it's something that's going on at night, is there some type of restless leg thing going on? And then, of course, there's all the wise tales of what can you do to reduce these cramps. And obviously, we don't usually recommend those because there's not a lot of research to guide that. But in regards to sometimes where people say, oh, eat some mustard or do this, that could be maybe due to, sodium impairments. Maybe there's a lack of sodium, or like I said, on the other side, usually we get enough sodium, so usually it's maybe a lack of potassium if it's more systemic. Maybe Dexter knows a little. Anything else to say?
Yeah, there can be a number of factors, but some of the things that we can control with physical exercise is making sure that you have that flexibility to maintain the length of that muscle, and making sure the muscle is strong enough to kind of handle whatever task that you're doing. So if you're doing a lot of walking and you're cramping, maybe that muscle needs to be conditioned more, and more exercise can be added to help with that, so the muscle doesn't cramp and lock up like that at the end of the night.
If you feel you're going to fall, are there particular techniques to use to minimize the injury that results from a fall? Like not bracing yourself with your hands, or I don't know, maybe you have some ideas?
So some of the issue, why do we get a fracture from falling? So strong bones don't break, even a lot of times from that force of a fall to the ground. So usually why a broken bone happens is because there's some osteoporosis or some bone mineral loss. So kind of what we talked about earlier, a lot of resisted or increased ground force reactions or increased resistance training can help reduce that osteoporosis or brittle bones to help reduce that injury of a fractured bone when you're falling. But in regards to specific techniques, I feel like you're not going to be able to really train yourself to say, oh, I'm not going to throw my arms out there unless we're throwing you on the ground and we're training you. And usually that's not something that we would recommend doing. But sometimes to graduate my patients after a surgery, I will practice doing a floor transfer, so kind of a controlled fall. And we can just kind of go over what I usually recommend, and maybe you can practice it on your own to kind of have a fall drill. So if, let's say you fall on the ground, you want to try to roll yourself. You want to try to roll yourself onto your stomach and then see if you can get into a quadruped position. Once you're here, you can try to crawl to some furniture. That way you can use your arms to help you get back up again. Because usually a lot of frail people can't get up without the help of their arms. They have a hard time doing a lunge from the ground or walking their hands up their legs. So usually I recommend crawling, even if it hurts. You're in a bad situation. So we want to crawl. If you can't crawl, can you scoot? Get yourself to some furniture. And then once you're at the furniture, you can come to this high kneeling, hopefully. And then you're in that high kneeling lunge position, and then you're pushing yourself up. Maybe you're facing the furniture so you can use both your arms to help you get off the floor. So that's something I'll practice with some of my patients that I'm worried about falling or getting off the floor, or I want to kind of graduate them after a surgery or a hospitalization.
And just to add to that, you might have seen some techniques online or videos, and those techniques can be helpful, but it's hard to do so when you're in that situation. An example of that was I remember one of my physical therapy instructors. He was just demonstrating to us like how to fall properly, and he was going to do this tuck and roll technique, but he missed it. And he broke his shoulder right in front of class, and he tried to hide it. But those techniques are effective if you're like doing some kind of sport or judo. But for us, I think the main thing is going to be for prevention. Using an assistive device. If you're feeling a little uneasy, sit down before it gets to that point where it does become a challenge. Use walls, use surfaces, use kind of assistive things around you, or just ask for help, so it doesn't get to that point where you have to worry about that.
What prehab exercises can I do for future knee replacement surgery?
So this is where I was talking about. I really wish these people would go to physical therapy before their surgery. And I'm always really surprised when I see them the same day of your surgery. Have you done any physical therapy for your knee arthritis or your problems before having surgery? No, I've never done any physical therapy. So I'm always surprised that people will just jump right into this really invasive procedure before preparing themselves or before trying maybe some other options. So prehab exercises are kind of focusing at educating you for what to expect after surgery, what type of assistive devices might work well for you, discussing your home situation, how are you going to navigate stairs, what's your support system going to look like. So a lot of it's education, but then the other side of exercises would be those 3 circulation exercises we talked about. Can we build up your quad thigh muscle as much as possible before surgery? Can we build up your hip muscles as much as possible before surgery? Can we work on your balance and transfers before surgery? And then just kind of going over the exercises, the range of motion things you're going to work on after surgery. So just because you get a total knee done doesn't mean that's magically going to make your range of motion better. There's generally some contractures in your muscles that have happened for years before this surgery. So you can kind of work on that flexibility before the surgery to kind of make that recovery a lot better.
Yeah, and these are also, if you are getting surgery, these are likely things, the prehab portion of it is likely something that your insurance will likely cover too, because you know, it will improve your overall outcome.
Good to know.
Getting back to the falls, I just highly recommend Kapuna, Aikido.org, that has an 8-week course on how to fall. So I take Tai Chi so that I don't fall, and then I take the Kapuna Aikido, and they teach you these techniques. And you really got to practice because fall happens so quickly that you don't have time to think, so the muscle memory. And so Kapuna Aikido, and I think several of us have taken that already. Highly recommended. 8-week course on how to fall on judo mats.
Thanks for that info.
Are there any other questions? Okay, I think that's all the questions. Thank you so much, Dexter and Rebecca, for informing us about exercise.